इसमें अलग क्या है?
कोल्ड स्टोरेज, डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Apollo family. A hearty meal might make your tummy happy, but not necessarily your heart. Are your food choices impacting your heart health? Let's understand more about diet and heart health in the upcoming episode of Apollo 24/7's Health Hour. Join us today 11 a.m. sharp while we bring you Apollo's expert cardiologist Dr. Vipul Narain Roy into a live session. Ask all the questions that you wanted to ask about your heart health. Join us 11 a.m.
It's always been there, standing between you and your health. A wall between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, welcome to Apollo 24/7's Health Hour, where we bring you an Apollo's expert every week. And this week we are bringing you an expert senior consultant cardiologist from Indraprastha Apollo Hospitals, New Delhi, Dr. Vipul Narain Roy, who is going to join us very shortly. We are going to talk about your heart health. How is your diet affecting your heart? pump in all the questions that you want to ask about your heart and food. We're going to take up live questions. I request you all to type your the questions on YouTube chat only. You may be watching this on various other platforms, but if you want to interact and get an answer for your question, we request you to type this question on YouTube chat, and please give us all the details like age, gender, and since how long and what medications, all of them in one question. That will be able to, that way I'll be able to take your question easily. All right, keep your questions coming in. Before we start the show, let me also remind you that you should be waiting for a health quiz on the show where we give away Apollo 24/7 is going to give away gift coupons as well, and also towards the end of the show we are giving you discount coupons. Stay with us till the end of the show. Let's start the show today by talking about this wonderful initiative which is called Sachi, Saving a Child's Health Initiative, which is free pediatric consults for every child in need. Sachi, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. This program is benefiting children across India. More than 10 plus pediatric specialities who are renowned Apollo pediatricians are participating in this. So if you know a child who requires this program, please share the good word. There's a QR code on the screen. You can scan the QR code to know more about Sachi. All right, let's talk about today's topic now. What are we eating? Is the food that we are eating helping our heart, or is it affecting our heart detrimentally? Let's talk about heart health and diet. Joining us is Dr. Vipul Narain Roy, Senior Consultant Cardiologist from Indraprastha Apollo Hospitals, New Delhi, who's more than 30 years plus experienced, and he's associated with Regional Adult Cardiothoracic Center at Liverpool. His achievements are consultant in interventional cardiology with more than 10,000 interventions which are done, and he's published in 6 national and international journals, has written a book on interventional cardiology as well. We welcome Dr. Vipul Narain Roy. Namaste, doctor. Welcome to the show. It's
Thank you, Ms.
very good. Thank you, sir. Thank you. It's a pleasure and honor having you on this show on this Sunday morning. It's such a great experience. We are looking forward for some amazing answers that will be answered for our audience. So, doctor, let me take this forward with one straightforward question. अगर food का नाता है heart के साथ, what kind of relationship should our food have with heart?
आपका क्वेश्चन बहुत ही सेंसिबल है. देखिए, आज की सबसे जो कॉमन डिजीज है वो है एथेरोस्क्लेरोसिस. एथेरोस्क्लेरोसिस सबसे कॉमन है, सबसे ज़्यादा लोग इसी से सफ़र करते हैं, और इससे बचने के लिए हम लोगों को अपना कोलेस्ट्रॉल, जिसे हम कहते हैं, मेनली एलडीएल कम रखना चाहिए. तो सबसे पहले हमें एनिमल फैट्स कम करनी होगी. तो यदि आप नॉन वेज खाते हैं तो रेड मीट और एग का येलो, जिसे जर्दी बोलते हैं, वो एकदम कम से कम या बंद कर लीजिए. नॉन वेज में एग वाइट, फिश और चिकन लीजिए, वो भी बगैर घी तेल मक्खन का लीजिए. और जिसे हम वेजिटेरियन कहते हैं, लेकिन उसमें भी एनिमल फैट होती है, जिसे डेयरी फैट कहते हैं, जो है देसी घी, मक्खन, मलाई, खोया, पनीर, मिठाई, आइसक्रीम, केक, पेस्ट्री, स्वीट, चॉकलेट, इन्हें कम से कम लीजिए.
So the list that you have given involves so much ki it's ghee, butter, paneer, what else? Cream, full fat milk, sugary
Sweets.
foods and drinks, sweets.
मिठाई, आइसक्रीम, केक, पेस्ट्री.
जो भी हम celebration, whatever that we're talking about, the kind of food that we're talking about is involved in a celebration basis, right? Every day जो हम लोग celebration अगर करते हैं तो food के नाते celebrate करते हैं. We all celebrate. It's become a way of our life, I suppose.
आप कम लीजिए, बहुत थोड़ा सा लीजिए.
Okay.
स्वीट्स कम ही लीजिए, थोड़ा सा.
So a little goes a long way. So what kind of effect does our food have on heart, doctor? If I've started to eat all these no foods, the bad foods for heart, what can one experience?
देखो, problem is your LDL will go up. It will cause blocks in arteries. So block in heart arteries will reflect as heart attacks. Block in brain arteries will reflect as paralytic attacks, dementia. Block in leg arteries can cause you gangrene, loss of limb. Block in kidney arteries can cause kidney damage. So basically, it is the biggest problem the mankind faces today is atherosclerosis. One of the biggest problems. One of the simplest thing we can do is by reducing the animal fat in our diet. It's one of the simplest thing we can do. It will affect.
तो
It will help
रास्ता
us in
यहाँ
long run.
पर so we have
See, let
so
me
we
tell you
repeat
one interesting thing. Let me tell you one reality actually. As a species, we have left nature far behind.
yes
If you look at the element of nature, we as, I mean, hominids or Homo sapiens are a hunter gatherer. In nature, food was never there in such a plenty. Imagine the life of a hunter gatherer who was in forest. He does not have access to a fridge. And this age is after agriculture revolution and after food processing revolution. So this taste was there because the body needs carbs, body needs low carbs, body needs fats. That's why these states were there. But the food in nature is not in that abundant supply as we see today, courtesy
correct
agriculture and courtesy food processing technology. That's why this is. Remember, even the tiger, which is at the apex of food chain in our forest, has to spend up to 7 days hungry. Even he has to
exactly
go through. The food has never been in so much abundance as it is today.
correct so while doctor you say that there are certain foods and food groups which can cause harm to heart health are there any food which can do good to heart are there any superfoods which can vouch to have a good effect on heart
Well, you have asked a very good question. See, there's nothing established in medical literature as superfood. But few things are perceived good, as you showed in the ad: garlic, walnuts, flaxseed, fish oil. So having them is supposed to increase the HDL, which is good for heart. So you can have them, but don't have them in excess because then you will add up a lot of calories and you'll gain weight, triglycerides will go up, sugar will go up. You can have them in a sensible amount. There's no harm in taking. You can have them, but as
great
a medical literature goes, there's nothing established as superfood as medical literature stands today.
Okay. So, doctor, why you were saying calories ज़्यादा बढ़ाना नहीं चाहिए, and also you were talking about cholesterol, which is bad, which comes from within our diet. We add cholesterol or triglycerides through our diet or dietary habits. What kind of harm does cholesterol do to heart?
You see, as I told you just initially, it causes block in arteries. And depending which arteries are blocked, so when heart arteries are blocked, which is commonest, we get heart attack. Second common is the brain arteries are blocked, so we get paralytic attacks. Third is leg arteries are blocked, we get gangrenes. Let me remind you one more thing. In India, it's not only Alzheimer which is the cause of great dementia. In India, dementia, you understand, people lose all their memories.
Forget.
They don't. Yeah, vascular dementia is also very common in very common condition in India. Vascular dementia. So this
Okay.
causes dementia. So if you keep your cholesterol down, you have many long-term health benefits. Not only your heart, especially your heart and brain. These two of them.
Great. So, while understanding that already healthy heart को अपना food affect कर सकता है, but what if people are already diagnosed with heart disease or weakness in heart? You know, there are a lot of people who have certain conditions genetically or born with them. What about them? What is their food relationship? What should their food relationship with the heart?
See, you mentioned reduced weakness in heart. That's right. So
Correct,
this
doctor.
weakness in heart is people commonly count their on their nose. What is their LVEF? So when heart become apart from what I just told you about LDL, these people should reduce the amount of salt they have, and also should uh, reduce the salt and cut down their total liquid intake because their heart will not be able to pump enough blood to kidneys and their water excretion gets less, so they should reduce the salt and liquid intake over and above the other food.
जैसे आपने सॉल्ट बताया है अभी hypertension or BP is something that where we control salt intake But for heart health also, do you think that we should control salt, doctor?
See, people with high blood pressure, they should definitely control their salt intake. But if your heart is in good shape, LVF is good, you don't have hypertension, then there is no need to. Then you can enjoy it.
All right. So it's not a direct relation, but then there is an indirect relation. अगर hypertension बढ़ाता है salt, and hypertension in turn can affect your heart. So it's a cycle
Yeah,
that we are thinking
that's
about.
you are totally correct. So if you have hypertension, if you have high blood pressure, reduce salt because blood pressure will go up and it will damage your heart and brain both, and brain
Ah,
also.
right. Correct. So while I start to take questions from our audience, a nice interactive session. This is the first question I saw is from Susila Periyasamy. Hello, doctor. And what are the foods to be taken for a healthy heart? What are the foods that should be avoided? And how can we reduce LDL through food? Is that possible, doctor? And what is LDL? आप जरा बता दीजिए audience के लिए. And also, are there
LDL
any
is the
particular
bad
foods? Sorry, please
LDL is the
continue.
bad cholesterol. LDL is the bad cholesterol. If your LDL goes up, then you get these heart attack, paralytic attack. So as I said, the foods to avoid those animal fats, which I said in the beginning. But for to take extra is the fruits, vegetables, and other roti dal sabji will not affect. And another thing we should watch is the cooking media because cooking media is a big source of fat in our diet. So we should not use desi ghee, makhan or lard, the animal fat. In vegetable oil, we should avoid three: coconut, groundnut, and palm oil. These are very popular: coconut, groundnut, and palm oil, because these are not polyunsaturated. Most unsaturated are olive oils, sunflower. I mean, any of apart from these three, olive is best. Then sunflower, curdy, rice bran, mustard oil, whatever you like. But remember, buy vegetable oil in a small quantity because it will normally industry will sell you either in PVC or in tin. The PVC, since it's polyunsaturated, it will react with them. So buy in small quantities and at home transfer it in some stainless steel container and preferably keep it in a fridge. That will be
See,
my
it's not
advice.
just about consuming, but it's about how you are storing it and what kind of elements are entering into your food chain is also important there.
It is. You might be surprised to know there is a recent decision. You know the coffee is being served all across in the plastic mugs.
Huh?
People did a blood. They found good amount of microparticles of plastic in the bloodstream.
Oh my.
So plastic and PVC because it's very cheap for the industry to. If you are selling
Okay.
it, you have to look at your financial viability and your profits. So
Right.
people will sell it in plastic and PVC.
We
So
must we
avoid
must
is.
also be cautious about water which is being sold in plastic bottles there.
I think my wife is very sensible. She has bought some. My wife is a doctor as well. She's a gynecologist, very reputed gynecologist. So at my home, she has bought these what I call stainless
Steve,
steel. There's some metal and steel kind of thing. So we transfer the
I
water
think
in
we
that,
should
and
all.
that goes into it.
It's a great thing that we all should do, and we should
Oh
carry
yeah,
our own
same,
water.
similar.
Yes, doctor. So coming back to the cholesterol question, here is KKR's question. I lead a very healthy lifestyle. Despite that, my cholesterol levels are very high, both LDL and HDL, good and bad ones. However, my triglycerides are in perfect ratio. How can I control them?
If your triglyceride is perfect, then there is no need to control them. If your HDL is good, that's fine. Your generally there is a limit beyond which you cannot control your LDL by diet and exercise itself. The best thing is see your doctor and he will see whether this level of LDL is good for you. Normally, if somebody has no problem, then LDL 100 or below 100 is considered good. But then if you have any heart disease, family history, predisposing factor, diabetes, kidney disease, so visit your physician. He will recommend whether you need a cholesterol reducing medicine or you don't. If he recommends it, please take it.
Right. And also, I personally have a friend whose family has a history of heart attacks at a very early age. And this boy, being very lean and lanky, has very high cholesterol. Be with the history of family history of heart attacks, and he having cholesterol, he's very cautious. Each time that we work together, he is extremely cautious with his food. Is that the only way to watch out? Is the food the only way to watch out?
About this young boy and his family, since there is a early onset heart disease, they have to be very careful. So they have to bring their LDL below 70 or up to 55. And these are the group because they are very highly susceptible, and they should be, apart from controlling diet, which should be practiced in everyone in family who's beyond teenage and beyond. They should consider visit your doctor, and doctor will see whether they need a statin, which is a specific cholesterol reducing medicine. And this family should see a physician and see whether they
Done.
really need a cholesterol reducing medicine. Preferably
Okay.
a statin, not a non-statin.
Preferably
Statin. Cholesterol
a
reducing
statin.
medicine are of
Correct.
many
The
types.
medication. Yes.
STATIN. Statin are a
Correct.
group of
Statins.
medicine that will be
Exactly.
better than non-statin.
Great. So, in connection to the same conversation, Polash Das ji push rahe hai, as a regular 35-year-old, how to check, he's a 35-year-old, how to check whether the heart is in a good condition or not, other than regular monitoring of blood pressure, and what age one should start?
Well, if you ask me, I would say you should start earlier than that, something like 18, 19. What are the things you should do is do exercise regularly and control your diet. What you should get checked is your blood pressure, blood sugar, blood cholesterol, and creatinine. These four things I think you should get checked once every year.
Okay. So, it should start as young as 18-year-old, and how
I
frequently
would
should
say
one monitor?
that. Let me tell you something very interesting. When I was in medical school, we were told that this is a degenerative disease. What it means simply that it is related to age. Once we get older, we'll get this disease. Then see the Korean war victims autopsy was done. So as a routine, they did the looked at atherosclerosis. And as young in 20s, they found atherosclerosis. So it has changed the paradigm that it is not age related. Forget it that it is age related. I have personally done many angioplasty in boys who are in early 20s. I have done angioplasty in girl who was 22. I've seen bypass in a girl aged 30. I've done angioplasty in a boy aged 4.
Oh. So, age is not the parameter
So
to
start
control, to
early. The
understand
best time would
health.
be, unless you have a family history, the best time would be once you go late in teens, 18, 19. That's when you should be sensible. And those who have family history, strong family history, as that other boy you were telling earlier who has family history, they should seek the consult of their physician before that.
Great. So here's Lokesh's question: how to decrease the level of triglycerides, and what is the effect that it has on heart?
Triglyceride, after LDL, triglyceride is the other bad cholesterol which affects our heart. Remember, triglyceride is related to sugar moiety. Compared to LDL, triglyceride is much easier to control. So cut the sugar moiety, which means cut sweets, cakes, mithai, ice cream, cake, pastry, sweet chocolate. Cut fruit juices. Remember, suppose you have a friend and you invite him that I'll give you juice of 20 oranges, he'll jump and come to you. But if you tell him I'll give you 20 oranges to eat, he'll run away. So when you are taking fruit juice, you are having all the sugar of it and throwing the in the pulp you are throwing
Fiber.
away, you are throwing out a good thing. So cut apart from these sweets, cut on fruit juice, rice, all those things like diabetics too. I'm not saying you have diabetes, I'm not saying that, but if you cut the sugar in diet, triglyceride comes down. Remember, alcohol is fermented sugar. So reduce
Right.
alcohol also if you want to control your triglyceride. By doing that,
Yeah.
most people will be able to control your triglyceride and they will really need medicines to control triglyceride.
Right. So next question is Ramyajit Dasgupta. I'm experiencing pain on left side of the chest. I tested ECG, echo, both of them are normal. After testing lipid profile, serum cholesterol is 258, LDL is 178, higher than normal. So now, can we do this reversal only with food? If a people section of people can reverse cholesterol with food, or everybody needs statins?
See the kind. I'll answer this question in two parts. The kind of pain you described this young man has is unlikely to be angina. But you mentioned his LDL is 170 something, isn't it?
Exactly, sir. LDL is
178 or
178.
178 is very high LDL. Unless he has very bad food habits. I mean, we do come across patients who have very bad food habits. Unless he has a very bad food habit, he will not be able to control this level of LDL by control of his diet and lifestyle exercise alone. Most likely, he will need to see his physician. And once again, I said he should do his lifestyle, repeat it again after 2 3 months. He stays high, he must visit his physician. It's a very high LDL.
Right. So, who requires diet modifications and who requires medical intervention, especially when the cholesterol and triglycerides are high?
देखिए जो डाइट मॉडिफिकेशन तो अगर आप मेरी बात मानो तो हर कोई जो 20 साल का हो गया अनलेस कि आप एक प्रोफेशनल एथलीट हो या साइकिल रिक्शा चला रहे हो या बिल्डिंग से इतना ज़्यादा आपका फिजिकल लेबर है कि आप बहुत उतना फिजिकल लेबर अब किसी का है नहीं आजकल किसी का सब लोग जो मतलब
Comfortable
आप
lifestyle.
मेरी बात का समय से बुरा न मानना जो लोग जो थोड़े पुअर भी वो भी ऑफिस में बैठे हैं चपड़ा मेहनत फिजिकल लेबर बहुत कम है फिजिकल लेबर तो 20 साल के बाद सभी को करना चाहिए अनलेस कि आपका फिजिकल लेबर बहुत ज़्यादा हो तो डाइट कंट्रोल तो सभी को करना चाहिए अगर
जी.
आप मेरी उसके बाद भी अगर आपका ज़्यादा है तो आपको अपने डॉक्टर से मिलकर डॉक्टर की एडवाइस में दवा लेनी चाहिए अपने मन से नहीं लेनी
Yeah. Exactly. Done. So next question is Sai Srujan Paspuleti. Srujan is asking, why are young people getting cardiac arrest, even though reports say that everything is normal?
see report says everything normal well what have you it, it's not easy the kind of examination we do it's not easy to tell everything perfectly why young people are getting heart attacks is because as I said somewhere earlier that we have left nature the physical activity is not that much if I see my own neighborhood if I remember my own childhood we used to play a lot we didn't have
Correct.
computer games and all playing on the smartphones. So we used to play hockey, football, cricket, these type of games and much more. The kind of neighborhood I live in Delhi, I see very few children involved in physically running around and playing games. So that's one
And
thing.
also pandemic has put us all into one space where we are not able to move
Uh,
much.
and another thing is, I mean, not only in boys, even in girls, the smoking is going up and up. Tobacco is going up and up. This is a very big problem. Very big.
Hmm.
I had treated a very young girl. She was a medical student. She was only 20. She used to consume tobacco to suppress her appetite. And she ended up having a heart attack before completing her MBBS. She used
Oh.
to appetite.
So
So,
younger
so these
population
are the
is
two
at
things in my these are the two things in my view. That's it.
done, sir. So that's a good advice. So here is Gopal Rathi. Which cooking oil should we prefer in our day-to-day life for betterment of heart?
It's not only heart, I would recommend we should all do it. We should avoid desi ghee, makhan and lard. Use vegetable oil, any vegetable oil except coconut, groundnut and palm oil. Preferably olive oil, sunflower and as I told
But
you earlier about my wife, the way she stores it, I think there should be a model for all. My wife
but
is a
doctor,
gynecologist.
Yeah. That's a good, interesting input from her because we trust doctors there and your lifestyle is very positive. Doctor, but then regions like Kerala or parts of Malabar coast, for them, cooking in coconut oil is very common as a practice in South India. So, how do we
See,
understand that?
if you just look at coconut oil, if you keep it at room temperature, it's likely to get solidified. In winter, Kerala doesn't get winter. I love going to Kerala in winters, but here, if in Delhi winter, it will become solid. You'll have to heat it to become liquid. So that gives an idea that how saturated it is, not polyunsaturated. These three vegetable oils are not polyunsaturated. Coconut, groundnut, and as far as cultures are concerned, as I told you somewhere earlier, food was never so much in plenty. So whichever geographical part it is, whatever was naturally available, the food habits relate developed related to that. But it's better to avoid it now.
Okay.
My advice would be avoid it.
All right, doctor. Thank you so much. So here's Anand Babu. What are the factors affecting the heart rate? Is Nevibolol safe? This is the only detail that Dr. Anand Babu has given.
I'll tell Anil Babu not to count his heart rate. That's the first thing I will tell him. Okay? Heart rate and blood pressure. In nature, they have been designed to fluctuate. It is not a Reserve Bank of India interest rate that varies with 1 point, then it will be problem. The nature has designed heart rate and blood pressure to fluctuate. It will fluctuate over several 100%. In some animals, it fluctuates more than 10, 20,000%. The first advice is if he has no problem, don't count his heart rate. There is a fad in young boys wearing a specific watch, keep telling heart rate, goes to gym. I have done exercise, my heart rate didn't go. Go to gym, exercise, you get sweat, you are breathless, your body is tired. First advice is don't count his heart rate. Second, if you think your heart rate is very fast, see your physician. See your physician. Natural things which reduce heart rate is good amount of dynamic exercise, and there's a reason behind it. Suppose you pick any boys and girl in your neighborhood and ask them to run, then they'll get out of breath, and the thing that determines is our muscles of arms and legs, what we call is skeletal muscle, the way they are using oxygen. So if you run like athletes who are doing exercise, like say marathon runner who's running continuously for 46 kilometers, their muscles will develop anaerobic glycolysis. They'll get used to, they will extract more oxygen. So that's where they reduce heart rate. The Indian hockey team, let me tell you some interesting fact. Indian hockey team which won Kuala Lumpur gold medal World Cup, average heart rate was 42 only. Not because they were taking nebuvolol, not because they were taking, that's because they were exercising well. Good amount of dynamic exercise. If you are taking nebuvolol to reduce your heart rate on your own, nebuvolol is a beta blocker. You will be able to reduce your heart rate, but you may invite many complications of beta blocker, which is not as best way to do. I summarize my advice: don't count your heart rate, don't wear these watches, don't go to gym and count, watch running treadmill and looking treadmill is telling you heart rate and all this. Stop doing all that.
ठीक
That
है
will be
तो
my first advice. And ask
तो
your doctor
ये
if you need medicine to reduce your
या
heart rate.
सो वे अच्छा ये भी बता दीजिए अगर मुझे हार्ट रेट काउंट नहीं करना चाहिए ऑन अ रेगुलर बेसिस किसको डॉक्टर से मिलना चाहिए कितना हार्ट रेट ज्यादा होता है कि मुझे डॉक्टर से मिलने का अलार्म रेट है
देखो हार्ट रेट जब बहुत ज्यादा, नेचर की एक रूल है, देखो नेचर एक बैलेंस में चलती नेचर एक बैलेंस में चलती है। जैसे आपने किसी का ब्लड शुगर क्या आपने कहा ब्लड शुगर बहुत ज्यादा है डॉक्टर को मिलना होगा, ब्लड शुगर बहुत कम है डॉक्टर को मिलना होगा। ब्लड प्रेशर आपका 280 सुपर सिस्टोलिक हो गया या सिस्टोलिक 70 के नीचे हो गया तो डॉक्टर को मिलना होगा। तो नेचर एक बीच के बैलेंस में चलती है। तो आपको हमने शुरू में बताया हार्ट रेट फ्लक्चुएट करती है, खूब फ्लक्चुएट करती है। तो बाबू क्या नाम बताया था इनका? बाबू,
आनंद बाबू।
आनंद बाबू के अगर नियरेस्ट स्कूल पे हम जाए, जहाँ बच्चों का स्कूल है इनको, और हर बच्चे को एक होल्टर लगा दें, तो आप पाओगे हर बच्चे की हार्ट रेट कभी 170-80 पहुंच गई, 80-90 पहुंच गई, 190, और हर बच्चे की हार्ट रेट कभी बहुत कम हो जाएगी, 60-70 भी, 50 भी हो जाएगी। इसका मतलब थोड़ी हर बच्चे को ले आओ और एक कार्डियोलॉजी वार्ड में भर्ती कर दो। नेचर ने ऐसा बनाया हमको कि हमारी हार्ट रेट, हमारा ब्लड प्रेशर खूब फ्लक्चुएट करेगा, करने दो। जब तक आपको खूब ज्यादा पैल्पिटेशन न हो, खूब तेजी तेजी पैल्पिटेशन न हो, चक्कर न आने लगे, बेहोशी, तो आप इसके लिए डॉक्टर से मिलने की भी कोई जरूरत नहीं। ज्यादातर ये पैल्पिटेशन के लिए मरीज आते हैं, 99% को कोई बीमारी ही नहीं होती। ये जो घड़ी आजकल की पहन ली है ना, यही बीमारी है।
Okay, that's it. Thank you, doctor. So next question is from Nutan Kumar Naranje. Age है 33, TMT treadmill test done and positive है. Will this cause heart attack? My LDL is 114.
देखो ट्रेडमिल टेस्ट, अगर एक रूल जान लो, जनरल रूल, दैट इज कॉल्ड बायर्स थ्योरम ऑफ प्रेडिक्टेबिलिटी। कोई भी आप टेस्ट करते हो तो डिफाइनिंग टेस्ट बहुत, आपको मैं पहले एक अपना एग्जांपल बता दे तो सब मैं आपको शायद ज्यादा समझा पाऊँ। जब मैं मेडिकल कॉलेज में सेलेक्ट हुआ तो मेरे पाया गया कि मेरे एक होल था हार्ट में, तो हमने सबसे पहले मरमर अपनी सुनी, पहला कैरेक्टर अपना देखा, तो कुछ चीजें एकदम डिफाइनिंग होती है कि हाँ ये है। हर टेस्ट डिफाइनिंग नहीं होता। The treadmill is designed to tell you whether you should have angiogram, whether you have certain particular medicine treatment or not. अब ट्रेडमिल को आप ऐसे इंटरप्रेट ना करो, ट्रेडमिल को आपको अपने डॉक्टर को इंटरप्रेट करने दो, क्योंकि वो आपसे बेटर समझता है बायस ऑफ प्रेडिक्टेबिलिटी, और आप प्रॉब्लम में पड़ जाओगे अगर खुद इंटरप्रेट करने लगे। तो ट्रेडमिल का इंटरप्रिटेशन आप अपने डॉक्टर पे छोड़ो। अगर पॉजिटिव है तो आपको अपने फिजिशियन को मिलना बहुत जरूरी है, और वो जैसे गाइड करे वैसे जाओ। नंबर 2, आपने बताया आपका LDL 114 है, LDL 114 थोड़ा ज्यादा है। अब आपके डॉक्टर देखेंगे कि आपको कितने प्रीडिस्पोजिंग फैक्टर है, जैसे फैमिली हिस्ट्री, आप स्मोक करते हो या नहीं, आपको डायबिटीज या ब्लड प्रेशर है या नहीं। इसको देखते हुए आपको बोलेंगे या तो अभी आप परहेज और करो या दवा लो। आपको अपने डॉक्टर से मिलना जरूरी है, और ये सारी चीजें देख के ही वो आपको एडवाइस कर सकते हैं। इसके बगैर वो देख के आपको अच्छे से एडवाइस करेंगे। हम इस प्लेटफॉर्म पे आपको अच्छी एडवाइस देने में असमर्थ हैं।
Okay, done. Falki Psych, I don't know the name, but should medications be taken for total cholesterol above 210 and triglyceride above 220?
Triglyceride is above
220.
triglyceride above 220. If you reduce the sugar, alcohol, fruits, etc., you will be very easily able to control it. Now, total cholesterol, we don't. We see the spectrum. How much is your LDL and how much HDL and non-HDL cholesterol. If LDL is high, follow the steps which we discussed earlier with Ms. Hasi. And if it's still high, see your physician. Don't become your own physician.
Yes, doctor. That's a very, very, very important announcement to be made. Don't become your own physician and Google को अपना doctor मत बना दीजिए. There are experienced and qualified doctors. All right. Doctor, a lot of people are asking how to control triglyceride levels. ये triglyceride खाने से ही होता है या congenital भी हो सकता है या also genetical भी हो सकता है?
ट्राइग्लिसराइड का कॉमनेस्ट रीजन होता है शुगर बॉडी, कॉमनेस्ट रीजन, जिसमें कॉमनेस्ट होता है अल्कोहल एंड स्वीट्स एंड राइस, एक्सेस अल्कोहल स्वीट्स है, तो शुगर ये कम कर लो, कम हो जाए। कुछ बीमारियों में कोलेस्ट्रॉल बढ़ता है, जैसे लिवर की हो, पैंक्रियास की हो, उनका ट्रीटमेंट जब भी होता है। और कभी कभी अगर मीठा कम करने से बंद नहीं हुआ तो आपको दवाइयाँ लेनी पड़ती है, जैसे फाइब्रेट ग्रुप ऑफ ड्रग या एजिटिमाइड, इस तरह की दवाई। लेकिन ज्यादातर मरीज खाने के कंट्रोल से कम करते हैं। रिमेंबर, अल्कोहल कम करना जरूरी होता है अगर ट्राइग्लिसराइड।
अच्छा, okay, interesting. So Dilip, Abhishek, Lokesh, I think your triglyceride question is answered here. And yes, BP, diabetes, and heart disease. What is the relation between these three? These are three people who are asking this important question. If you can answer this.
See, all three are very common. Let's start with commonest, which is high blood pressure. If you have high blood pressure, then you damage the vessel. When blood pressure, the blood is running in the arteries. So very high blood pressure will damage wall of arteries and will cause more atherosclerosis, which will reflect what we call heart disease like heart attack, paralytic attack. Similarly, when the diabetic have two components. One is high sugar. So since the now we have medicine which will control sugar very well in form of tablets, insulin. Even if your blood sugar is 600, 700, insulin will bring it down. Diabetic have another component which damages the arteries, causes atherosclerosis. So now the 80% of diabetics succumb to the atherosclerosis or the heart disease. So diabetics, blood, for these two reasons, high blood pressure and high blood sugar damage arteries and cause more atherosclerosis or heart disease. So anyone with heart blood pressure or diabetes must control their blood pressure and sugar very well. I repeat, for diabetic, they should bring their LDL below 70 or below 55, and diabetics will very commonly need statin to control their cholesterol over and above the diet.
Okay. So LDL under 70 ला दीजिए. सत्तर से कम ला दीजिए if you are diabetic. And one standard rule is control your diet so that you can control your diabetes, hypertension, and thereby you can help your heart. Dr. Dheeraj
I will
Sikka ji
just say one more thing. I mean, don't have impression that you will be able to totally. I mean, even if you are not able to come off the medicine for blood pressure or blood sugar, you will have one more advantage that you will be able to reduce the dose of those medicines and have
Okay.
less side effects. So don't underestimate that.
Right. I think it's an important point that you have raised. Kashyap Katkar is asking this question. How to control hypertension? I am taking Metasartan 50 once daily and occasionally I do workout. I eat a lot of rice being a South Indian. So now that you have said that bringing medication level down should be your priority along with diet.
First thing I will tell him to control is salt. Okay, if he takes alcohol increases blood pressure. Cut his alcohol. If he has excess weight, reduce his weight. If he does these three things, this medicine requirement will come down. It's always advisable to bring down your medicine requirement because then you don't have to put up with so much side effects of the medicine. That's a
Correct.
very big advantage.
Great. So
So
Dheeraj
this is a
Sikka ji
young
पूछ
man.
रहे हैं.
He's taking metosartan. Metosartan has metoprolol plus telmisartan. So he's being exposed to two drugs. And young
Chemi-
man, Peter, I will advise him to do these things so that he can come off or reduce he will be able to reduce the dose of his medicine.
All right, sir. Next question is from Dheeraj Sikka. I am a DVT patient. Please advise what I should do as my left leg swells very frequently. I wear compression stockings and also take blood thinning medicine regularly, but this is making me unable to walk or do exercise.
See, if there's swelling in one leg only, it has to be seen for venous thrombosis, wearing stocking. So he must visit his physician, he must visit his doctor and ask him to do basic things like venous Doppler and a pelvic ultrasound. If these two are normal, then his doctor may advise some more tests. This is not the right platform to discuss it because these two things are
Exactly,
normal,
doctor.
then his test actually. Swelling in one
Right.
leg
So
only has to be taken seriously.
done. So Dheeraj Sikka ji, please consult a proper, efficient cardiologist, and Dr. Vipul can be contacted on Apollo 24/7's online platform as well. Sir, ये next question है साजिदा अफजल जी का. I'm 58-year-old. I have a clot and artery in leg. So my PR had increased. Doctor had given me ecosporin, Stillos 100 and clopitrova. So will I be cured?
देखो एक सैड पार्ट है, आई एम सॉरी मैम, आपको एक सैड पार्ट बता दें, कार्डियोलॉजी में क्योर वर्ड सिर्फ दो डिजीज में है, एक पीएसवीटी और एक पीरियड treated early in childhood. Otherwise, as medical science stands today, unfortunately cure word नहीं है. क्योर हम वर्ड हम लोग कहाँ यूज करते हैं? जैसे किसी को मलेरिया हुआ, आपने दवा दी, मलेरिया खत्म, अब उस मरीज को डॉक्टर के पास आने की कोई जरूरत नहीं है क्योंकि मलेरिया जड़ से खत्म हो गया. तो ये जो आपने प्रॉब्लम बताई, ये प्रॉब्लम है आपकी पेरिफेरल आर्टरी की एथेरोस्क्लेरोसिस की. आपको दवा लेनी पड़ेगी, दवा की डोज ऊपर नीचे होगी, आपके ब्लड टेस्ट चेक करेंगे आपके डॉक्टर पैर का ब्लड प्रेशर देखेंगे एंड डिपेंडिंग ऑन दैट आपके दवा ऊपर नीचे करेंगे, साल में एक बार या साल में 2 बार. आई एम सॉरी मैडम, आपको अपने डॉक्टर से मिलना होगा, उनकी एडवाइस को आपको फॉलो करना पड़ेगा. आई एम सॉरी फॉर दिस
So
कॉमेंट,
it is important
अनफॉर्चुनेटली दैट्स हाउ इट इज.
to be on a track with the cardiologist, doctor, and it's like
That's
a
right.
relationship that we need to maintain for a long time.
That's right.
Yeah. Yes. So, Sajida ji, आप खुद का ख्याल रखिए and continue your medications. Bipin Tiwari ji पूछते हैं, my EJEF is 30% after a massive heart attack. I am 46. Is ICD the only solution for me?
The ICD is one of the things. What your problem is LVEF low after major heart attack. So we must first thing we must target is how we can improve this LVEF, and that will let your doctor decide whether you need an angiogram and revascularization. Number one. Number two, there are many medicines which help heart to improve its LVEF, and they are like beta blockers, preferably carvedilol, an ACE inhibitor or an ARNI, and MRA. These three group of drugs improve the LVEF. So let your doctor decide whether what dose and which way he gives. These two should be primary things because with that your LVEF goes up. Once your LVEF goes up 40-45%, then you won't need an ICD. If it fails to go up, you have to cut your salt intake, liquid intake, take these medicines, and then there are many forms of treatment. ICD is one of them, transplant, and there are many ways. And once again, I said that this thing becomes so complex that this platform is not the right way to discuss your problem. You have to visit your cardiologist. ICD is just one part of it. There are many other and many steps before something like ICD can be considered in your.
ग्रेट डॉक्टर. तो यहाँ एक रजिस्टर्ड यूजर का क्वेश्चन है, आई फील एंशियस, energy less and generally with some emotional and sensitive mind situations, although all the tests are showing normal, will this affect my heart?
इसका कोई yes and no आंसर नहीं दे सकता. देखो कोई भी, if you look, suppose if you go and see a doctor, so commonest people visit doctor to see fever. Fever could be malaria, could be typhoid. So treatment is different. What you have narrated are a group of symptoms. Unless you have the correct diagnosis, correct treatment is not possible. So what you have narrated to me, ma'am, is a set of symptoms. You must visit your physician and see what's the correct diagnosis for that, and that diagnosis will decide which path you have to take. And
यहाँ पर मैं
sorry, I cannot.
No, I understand, doctor. Doctor, I would want to ask you about stress and heart health. How good or how bad is stress for heart health?
It's a very sensible question you have asked. It's a very good question. Let me tell, if I go for my experience, I definitely believe that stress has a bad role and it does precipitate heart problems. But let's see what the way stress and state, the way how it has been described. Stress and state are words which have been borrowed from metallurgy. They are not words from medical textbooks.
Medical
Stress
terms.
means you have so many Newton force per square meter. That's stress.
Correct.
That is metal changes will call strain. That's this. This is very difficult to translate in a complex human society or a human environment. We have worked. I strongly believe that it does precipitate. Let me tell you one very interesting thing. Most stressful city to live in is considered Tokyo. Have you ever? It's a very crowded, very stressful city. It's very difficult to rent even a flight in Tokyo. People fly rent cubicles in Tokyo, and Tokyo has one of the least heart disease.
Oh,
But I strongly believe, on the basis of my experience, that stress and strain has a role to play. And let me tell you, you will not be able to avoid the stress in life. Stress is a part of life. In my experience, the best stress busters are believe that avoid stress. It cannot be whatever you can avoid. Have good sleep and do some regular dynamic exercise. Like doing regular exercise and ensuring enough sleep are the best way to handle stress. Don't go for
wonderfully
stress.
answered.
Don't ever go for stress medicines. They are very addicting. They're I mean initially you'll feel very good about it, but with the passage of time, in a couple of months you'll become addicted to these and you'll invite one more medical problem in your life. So don't go
All
for
right.
medicines for that. That will be my advice.
Wonderful, doctor. Thank you so much for giving your experience and insight there. Doctor, here's a question about oils and ghees. नरेश कुमार शर्मा जी पूछते हैं देसी घी कितना खा सकते हैं एंड देन महेश कुमार इज आस्किंग हाउ इज मस्टर्ड ऑयल एफिशिएंट फॉर हार्ट.
पहले शर्मा जी का कहें कि हमारा जो लिटरेचर है शर्मा जी वो देसी घी को मना करता है. देसी घी सैचुरेटेड फैट है तो जितना कम खाए. देसी घी का स्वाद इतना अच्छा होता है देसी घी और मक्खन का कि हर कोई ना कोई बहाना जुमला दोहा या शेर निकाल लेगा देसी घी के लिए और वो जुमला या शेर बहुत पॉपुलर होगा क्योंकि उसका स्वाद इतना अच्छा है. तो अगर आप हमसे पूछोगे तो हम तो ये कहेंगे देसी घी मत खाओ. महेश कुमार जी हमने आपको बताया मस्टर्ड ऑयल जो सब तेल है वो ठीक है वो अनसेचुरेटेड ऑयल है आप ले सकते हैं खा सकते हैं पर बहुत ज्यादा ना खाइए नहीं वेट बढ़ेगा आपका.
हाँ.
वेट बढ़ने के बाद याद रखिए जब भी वजन बढ़ता है ब्लड प्रेशर ब्लड शुगर ब्लड कोलेस्ट्रॉल ये तीन चीज तो बढ़नी ही बढ़नी है और थोड़ी और भी समस्या लेके आता है वजन. झांसी
राइट
जी
सो
हमसे अच्छा
ऑयल.
गाइड कर सकती है आपको गाइड करने.
Done. But doctor, oils have become so expensive, and then finding the right oil, right way process. जैसे आपने बोला कि उनमें ये माइक्रोप्लास्टिक्स का भी थ्रेट जो हमारे चेन में फूड चेन में आ चुका है. Sai Srujan is asking, olive oil is so expensive. What is the alternate for a groundnut oil?
ग्राउंड नट ऑयल अच्छा नहीं है मूंगफली का तेल अच्छा नहीं है. तीन अच्छे नहीं माने जाते मान लीजिए.
हाँ, so alternate
ग्राउंड
पूछते
नट
हैं.
कोकोनट एंड कॉपर जी कौन सा है.
Alternate for groundnut
कोई भी
oil.
ऑयल कोई भी ले. ऑलिव महंगा मस्टर्ड ऑयल ले लें सनफ्लावर कर्डी राय बहुत सारे ऑयल है ये तीन ना लें बस. बाकी जो आपको अच्छा लगता है जो आपका स्वाद लाइक करो जो आपकी मर्जी ये तीन मना किए.
Great. So here's Yogesh Lucknowi, 40-year-old. I've gone through angioplasty in 2019 with one stent placed, feeling pinching pain again and again, several times interval of times for seconds. Okay, but there are no signs of pain while walking. I'm sorry if I place the question wrongly. Do you want me to read it again, doctor?
No, I heard it. It's a very common
Oh,
thing. What
okay.
happens is all of us have seen around us that heart disease is having so much mortality. So, I mean, let me tell you one interesting data about the patients who will visit their physicians for chest pain. 80% will not have any heart problem. The problem with our friend here is that he knows he has heart problem because he has already has a stent in his heart. So remember one thing that I'm sorry, can I give you your example? You are the only one I can see in front of me.
Please go
Miss
ahead.
Lakshmi is sitting. Miss Lakshmi is sitting like this. At this particular time, her brain is doing hundreds of functions. It is organizing the at least 30-40 muscle tone in a different way. So our brain at a given time is doing more than 100 things. But in our conscious brain, only one thing is there. Only one thing which is there in its conscious brain is moderating the talk on this chat show. So similarly, in your case, whenever you get anything from neck till waist, any symptom between your neck and waist, it will creep in your active thoughts because you know you have heart problem. It will create anxiety. Let your doctor decide. Once you visit him few times, he will be able to guide you which pains to wear, worry which pains not. I'll give you one example. I practice in Delhi, somewhere near, there's a nearby town called Meerut, and a patient had come whom we have done PSVT ablation, and coronaries were normal. So these patients don't get heart attack. So he got a pain like this. This patient knew he had a heart. He hired an ambulance and came back. So when secretary told that he has come, I said, tell him. I didn't. I said, okay, I'll have to go and see him to his satisfaction. But I told his relative and my secretary within the game that he can walk back to Meerut because he will not get heart attack. So that's a psyche problem which patients get once they have had heart problem. He is one of them. So my answer comes back in the same way. Visit your physicians few times, he'll be able to guide you and he will come to know which type of pain he should visit. And he knows one thing, if he gets pain on effort, he should visit the doctor. This is one thing he has already learned.
All right. So, Doctor, next question is Mr. Kota Pulla Rao. What is mild CAD? What precautions to take?
What is my CAD? CAD is coronary
Mild.
artery disease. If you don't have coronary artery disease, don't worry. Your name is very musical. That's good. Enjoy. So enjoy your life. Live healthy lifestyle as long as you don't get it. And if you live healthy lifestyle, most likely you won't get it. Till you don't
Okay.
get it, don't worry about it.
Oh, all right, great. Bablesh Mishra ji is asking this question. Sir, if we get minor heart attack, what immediate action or remedy can we take while we are at home? Any home remedy to prevent minor attacks?
Well, you won't be able to prevent minor attacks. Whether it's a minor attack or major attack, there's something you will not be able to decide. Only a doctor will be able to decide. At home remedy, the aspirin tablet is widely available. So if you think you have had a heart attack, a tablet of aspirin is something, and rush to your nearest medical facility and let your doctor guide you. Somewhere down the
Yes.
line, Ms. Jhansi said, don't become your own doctor. You
No,
can take
right.
aspirin at your home.
Okay, doctor. Thank you. Ladi Swami ji पूछते हैं CABG is done in February 2018. One stunt is placed in 2019. Since May 2019, left upper chest continues to pain. I'm 62-year-old. Medicines continuing. Left upper chest pain. So, is it the same answer earlier का जो आपने बताया?
हाँ, उन्हीं का है कि आप जो आपको पहले बताया था जिन स्टेंट लगा था, सेम आंसर इनके लिए भी है कि घबराए नहीं और अपने डॉक्टर को
Done. All right. Doctor, I was tested with Holter and Harnath Reddy is asking this question. And doctor has told me that I'm with 2.94 of ectopic beats in 48 hours test. Is this okay?
the ectopic beats is a very loose term. Generally, what he has not narrated whether it is supraventricular ectopic or ventricular ectopic, because these two are widely different. Supraventricular, and then which type of it is? Are they coming in couplets? Are they coming in runs? So the information is not enough. Generally, 2.9 on their own will not be too much to worry. 10% or more will be worry if it's VPC, SVC, don't. So enough information is not there to give a specific advice. But then across the board, I can tell him if he smokes, he must stop smoking. If he takes excess fizzy drinks like Coca-Cola and these caffeine, that drink excess tea, excess coffee, cut down his caffeine intake, and he should try these ectopics improve on exercise. Generally, ectopics which improve on exercise is benign. I'll warn him not to make these decisions on his own. There's no harm in visiting his physician. There's no harm because he can decide it much. I don't have that information right in front of me, so I cannot
Done.
decide on these things.
All right. So, and to conclude, Sai Srujan was asking, being a cardiologist, we would like to know what your lifestyle is. So, with that, I would want you to give us top tips of adding good foods in life.
Well, my lifestyle, I try to do regular exercise at least 40-45 minutes, 5 days a week. Do. And I'm very sensible with my diet because the kind of complications I see all around me all the time. Somebody in my shoes will become very sensitive. So, first thing you should ensure good healthy diet, do regular exercise, and try to sleep enough. These are the three things I would say.
Right. So, top tips. What are the bad food that we need to avoid, doctor?
Say that again, please.
What are the three top foods that you want us to avoid? Top tips may, what are the important foods to be avoided?
Avoid just animal fat one. I gave this. I
Doctor,
can
can you please go
say
back
that
a little? Your head is being cut. Can you please go back a little?
the
Your
same
head.
same thing as I said. Cut the animal fat. Cut the red meat. Cut the egg yolk. Cut desi ghee, makhan, malai, khoya, paneer, mithai, ice cream, cake, pastry, sweet chocolate. Cut on these. That's it.
That's
And
it.
cut
Thank you so
coconut,
Yes.
groundnut, and palm oil. These all.
All right, doctor. Thank you so much. It was a very, very insightful and informative session. And you had such a natural charm in answering these questions, so very well explained and answered. Thank you for this time on Sunday
Thank you,
morning.
ma'am. But thank you so much, ma'am.
Wonderful session, doctor. Thank you. And that's
Thank
Dr. Vipul Narain Roy for us on the Sunday morning. And now it's your chance to answer questions. I'm going to ask you 3 questions in health quiz. Please type your answers only in YouTube chat box. Winner's name will be announced towards the end of the show in a short while. Winners, once you are declared a winner, please mail your contact details at marketing@apollo247.com and gift vouchers will be shared with you. आज के questions ये रहे आपके screen पर है. Name the most common ingredient used in everyday cooking which may raise blood pressure if consumed in large quantities. What is that most common ingredient which is used in everyday cooking which may raise blood pressure if consumed in large quantities? Question number 2. When is World Heart Day celebrated? बहुत ही सिंपल क्वेश्चन है, गूगल कीजिए और आंसर टाइप कीजिए. Question number 2 is when is World Heart Day celebrated? And the last question for today, from what disease does Apollo Kavach program keep you safe? Apollo Kavach is a program which keeps you safe from which disease? ये थे आपके 3 questions. Please type your answers only on YouTube chat box. And I'm waiting for the winners while the team is selecting the winners. Let's also look at the coupons which we are giving away today. The first coupon we are giving away is doctor consultations direct from Apollo. You can get up to 150 rupees off on first online consultation. You have to use the code FIRSTVC. This is exclusively, you have to use this on Apollo 24/7. Download this app and you can get wonderful discounts and also great benefits. All right, next coupon that we are giving away is order medicines direct from Apollo. You get 25% off on online medicine orders, and the code that you have to use is FIRST3, FIRST and numeral 3. Use this on apollo247.com, Apollo 24/7 app. All right, so while I'm waiting for the winners, let me see what the answers are looking like. 29th September, Sushila, Thakers, Ramya Nagraj, Isha, Sai Srujan, Tejinder, Sukhdeep. Wow, so many people participating in the questions, in the quiz. Thank you so much, all of you, for participating today. And to all the Health Hour viewers, here's a special coupon that you have participated in this show today, and we are giving you a coupon which is HH247. Use this on Apollo 24/7. Use HH247, you get 199 off on online consultation with Apollo doctors and 20% off on medicine orders. This is exclusively for Health Hour viewers. Use the coupon HH247 on Apollo 24/7. All right, and I'm still waiting for our winners this week. While I wait for the winners, let me tell you that this show is being aired on Apollo 24/7's YouTube channel, also on the Facebook pages and multiple other platforms that you can find us. But on the YouTube, please do subscribe us so that you can get regular notifications and you will never miss a session. Isha 65, the winners I'm going to announce are Isha 675, Ramya Nagaraj and Bhanu Prakash. Congratulations. Please write back to us and claim your gift vouchers from Apollo 24/7. Next week, we are coming up with an interesting session, which is PCOD 101. Everything you want to know about polycystic ovary disease, the myths and how to manage. Tune into Health Hour 29 May 2022. That is 11 a.m. We are going to talk about PCOD. Subscribe to Apollo 24/7 so that you don't miss a session. All right. Thank you all of you for joining us and asking your questions, because your questions make a difference to a lot of people. Your question is answer to many. Thanks to Dr. Vipul, to all of you audience. Please stay safe. Namaskar.